It is good to be back at Michigan and in the University of Michigan. I grew up as a Wolverine fan. My brother went to Michigan State. He's now, and he was elected to the Board of Trustees of Michigan State, and so I had some divided loyalties, but I have been a Michigan and a Wolverine fan for a long, long time, and it's good to be here and see how the campus has grown, how this extraordinary facility has become larger and has attracted more and more talent. I also see a number of dear friends in the audience. I won't introduce them all, but my sister Lynn is here, and appreciate her being here. I see my classmate from high school, Stu White, here. It's like being home, and I really appreciate the chance to be here in Michigan. I'm going to talk today about repealing and replacing President Obama's health care system. And I know that some people, when I talk about doing that, say, wait a second, I've heard that your plan in Massachusetts is an awful lot like President Obama's plan. And so why is it that you're so anxious to repeal his plan and replace it with something else if it's so much like what you did? And so with that question in mind, I thought that before I talked about my own plan, I'd spend a moment talking about what we did in Massachusetts, how President Obama's plan, in my view, doesn't work properly and should be repealed, and get that groundwork laid. I'll start off by really being at I don't know, 100,000 feet, and talking a bit about the country and what makes America work. Because when the founders got together and decided what kind of nation we'd be, the first decision they faced is whether we would be a nation governed by a strong central government, or a king-like structure, that would tell us how to live our lives, what to do with our lives, what we'd make and how to make it and where to ship it, or instead whether we would be a nation guided by the aspirations of individuals. And they chose the latter. The people in America are sovereign, freedom to choose not only our elected representatives, but the freedom to choose our life's course, our enterprises. And that choice, that we would be a free enterprise nation, meant that people all over the world seeking freedom, seeking to pursue the dreams of their youth, wanted to come to this country. We are a nation of innovators and pioneers, creators. It is what has helped propel us to be the most powerful economy in the world. But this wasn't the only decision that the founders faced. They also had the question of whether America would be guided governmentally, primarily at the federal level, or instead at the state level. Whether the interaction that citizens had in education, in health care, and so forth would be driven by the federal government or by the state government. And in that case, they also made an unusual choice relative to our European heritage. They said, we're going to be a federalist system, meaning a state power system. So the 10th Amendment was specifically written to limit the powers of the federal government. And states retained most of the rights and responsibilities that affected citizens from day to day. The states, in the words of Justice Brandeis, would be the laboratories of democracy. They would try things, and we learn from one another. They'd also compete with one another. So the same dynamic that would propel our economy, competition and freedom, would propel learning between the states. The states would be responsive to the people that were closest to them. And of course, the solutions could be tailored to fit the needs of citizens in different states. And people ask me from time to time, why do you say that? What are the differences between states? Well, my experience is that health care delivery in Massachusetts may be different than health care in Montana or Mississippi or other places in the country. And so people could tailor their programs and their needs based upon the needs of the citizens. And finally, that model would lead America to have states that were more efficient, more effective, and more productive than if instead we had a one-size-fits-all approach to the government. I'm convinced, however, that the Obama administration fundamentally doesn't believe in that American experiment. They fundamentally distrust free enterprise and distrust the idea that states are where the power of government resides. And the most recent decision was the one made by the NLRB to decide that Boeing can't locate a factory in South Carolina. It was a power grab from states with the federal government saying we know better than states. That was the most recent example, and I think the most egregious example of this distrust was the Obamacare decision itself. So the first distinction between what we did in my state and President Obama's plan is this. Our plan was a state solution to a state problem. And his is a power grab by the federal government to put in place a one-size-fits-all plan across the nation. Now I know that some of my more liberal friends don't find that a very compelling difference. But those of us who believe that the decision to make America a federalist system was not just a throwaway decision, but an important fundamental element of what makes America such a successful nation. And that was something which, of course, is lost in Obamacare. But when I ask people what they dislike most about the president's plan, what I typically hear is they say Obamacare represents a government takeover of health care, and I don't like it. And I think they're right. What we were doing in our state was quite different than that. It was a more modest proposal, if you will. And that was, we're not having government take over and run health care. Instead, we're trying to find a way to get people in our state that didn't have insurance insured. And also to make sure that people who did have insurance wouldn't have to worry that if they changed jobs, that they'd lose their insurance if, for instance, they had developed a condition, a sickness, during the period of time that they had been previously insured. Now, there's some other differences. Under Obamacare, taxes are raised by about $500 billion over 10 years. We, of course, didn't raise taxes. And there were also $500 billion in Medicare cuts, not to bring down the cost of Medicare and make the federal budget more balanced, but instead to fund Obamacare. Now, there were some similarities. And one similarity that I know bothers people a lot is the fact that there is a mandate in the Massachusetts plan that I put in place. And let me tell you why there is a mandate in our plan. What we found in my state was that we had a number of citizens who recognized that they could get coverage, health care, even though they didn't have insurance. That's actually true in most states. If you don't have insurance and you develop a serious illness of some kind, cancer or a heart attack, you can get care, emergency care. You may not get the preventative care you need. You may not get all the follow-up care you'd need, but depending upon the state and the circumstances, you can get care without insurance. And many citizens who could afford insurance, having learned that they could get care for free, were saying, I'm not gonna buy insurance. If I'm healthy and strong, why would I get insurance? Because if something really bad happens to me, if I get cancer or something awful like that, I can go to the hospital and I'm going to get treated for free. And this was what we called a free rider problem. It wasn't a large number, but a growing number. And we found in our state we were spending hundreds of millions of dollars a year giving out care to people, many of whom could afford to buy their own insurance. This free rider problem was a real issue. And so we said, you know, we got really three choices. And most states have three choices. Someone can come up with some other alternatives, but the ones we saw were these. First, we could say to those people who could have afforded insurance, that didn't get it, and who, let's say, had a heart attack, we're sorry, we're not going to treat you. That, however, goes against the Hippocratic Oath, and it's against federal law. You're required to treat those people. So that's really not an option. The next option is the one that was being exercised in my state. We had the taxpayers pay for them. We were spending hundreds of millions of dollars. We're basically mandating to the taxpayers, you've got to take care of these people. We're adding it to your insurance premium or we're adding it to your tax bill, but you're going to pay for these folks. And we said somehow that's a big government approach. That government and taxpayers are going to give to people something that they should be able to get for themselves. And so we chose the last alternative, which is to insist on personal responsibility. And to say to folks who could afford to buy insurance, either buy insurance yourself or pay your own way. And ultimately the bill that we passed was a bill that said either have insurance or we're going to charge you for the cost of the fact that the state is going to have to cover you if you get seriously ill. And the charge maximum is about $120 a month. Obviously well less than the cost of insurance, but a pretty big incentive to encourage people to get insured. Now let me note here, this again, under the 10th Amendment, was a state decision. Other states can take a different choice, but the state decision